Go. Good evening, everyone, and welcome to part 2 of, what is the name of this course? Decisions of Faith, right? The place where we talk about medical ethics from a Jewish viewpoint. Last week in class number 1, we were discussing experimental drugs and what you could do, what you can't do, where it's proper to intervene, where it's not proper to intervene. And we had a number of different opinions among rabbis, shockingly, because usually there's a consensus. Don't you know about Judaism? There's always a consensus. So shockingly, there was difference of opinions. And guess what? The same thing will happen tonight. We'll have difference of opinions. But tonight, we are going to talk about what we call extended life. Okay? Where you should extend our lives, where we shouldn't extend life, and where we should try to intervene, etc., etc. Okay. The good news is, ladies and gentlemen, over a number of years, medicine has really developed to the point where we are living longer. Many of the diseases that killed our grandparents and great-grandparents have been, eradicated. They're gone. They're gone. That's the good news. That's the good news. On the other side, with all of this good news that we have, invites a bunch of ethical questions that come in. Because now we have the opportunity to extend life. We all have did these interventions that we can do. And then it comes up, we only have a limited amount of resources. Where do you put them? How do you put them? When do you put them? Do you force a patient to take it? Don't force a patient to take it. So tonight we're going to talk about those ethical questions about extending life from a Jewish viewpoint. Okay. Basically, there's 2 questions that we have to answer tonight, and we're going to delve in. Number 1, should individuals have the right to end their own lives? Now, we're specifically talking about someone that is maybe terminally ill, critically in, suffering, is in pain. Should these people have the right to say, what, Dayenu, it's enough. I don't want to suffer anymore. I don't want to do that. That's question number 1. Okay. Now you have patients who are suffering and they're ill, but through some intervention, we can extend their lives. Should we do that? I mean, sometimes it's painful, sometimes it's not painful, sometimes it's only a short-term solution, sometimes a long-term solution. How ill is the patient? Again, should the patient be forced to take these interventions? Should they not be forced to take these interventions? So that's two separate questions. Okay. So as we do normally, we have case studies. Okay. If you want to, this is a very long case study that if you have a book, and the people out in the cyber world don't have a book, so they're going to have to listen to me. But if you want to read case study number 1, it goes on for a couple of pages. It deals with this fellow by the name of David Goodall. David Goodall was an esteemed botanist and scientist in Australia.
Is that with Jane?
No, it has nothing to do with Jane Goodall. No, I thought the same thing, but it's nothing to do with her. This is David Goodall. And David Goodall was a scientist that lived in Australia. And he hit 104 years old. And he said, Dayenu, enough. He had one problem. He wanted to end his life, but he couldn't do it in Australia because Australia did not have end-of-life rights. It didn't. So he got on a plane to go to Switzerland, where Switzerland, much more liberal laws were there. Switzerland had a right to end your life. So he decided he was going to go there. Now, what were the circumstances surrounding? He was 104 and he was in pretty decent shape. Not perfect health, but at 102, he was still working. I mean, he had edited a 30-volume, volume books called Ecosystems of the World, and he was made a member of the Order of Australia for his scientific work. So he was in relatively good shape at 102. But recently he fell and he couldn't get to work. They forced him to retire. Imagine that. They forced him to retire at 102. He didn't take it. He sued. Know why? So he won. The university had to reinstate him. He lived in Perth, Australia. That's the one that's all the way west in Australia. But here's the kicker. They wouldn't let him come into his office because of danger of safety. So they made him work close to home, which made him very depressed, because part of his whole being of living was he met with people and he saw people and he wanted to do people and this and that, and they wouldn't let him do that. So that was that. Then he started, at 104, you start losing a bit of your eyesight, and you start feeling this, and you start crying here and this and that. So his children and grandchildren decided, maybe Zaidi, it's time to move out of your house. They wouldn't let him drive anymore, and they wanted to put him into a nursing home, and that would have really just killed him. I mean, not being together with his colleagues, not being able to write, not being able to do it. So he saw the writing on the wall, basically, and he's 104. I mean, we're talking about a guy 104 years old. So he saw the writing on the wall, and he sat down one day and he told his family, "This is what I'm doing." Okay, his family would agree. All right, they raised $15,000, so they sent him first class. He went off to Switzerland, and there he was going to take his own life. Okay.
Well,
assisted, but we'll get to it in a moment. We'll get into a moment of there's two types over there. Switzerland's about liberal because here in this case, most countries would not have, even the countries that were allowed it wouldn't have allowed him, because he wasn't terminal. He was depressed, and he was sad, and he was old. But that doesn't determine it. I mean, just because you happen to be 104 years old doesn't determine it. So Switzerland had already in 1942, this was during World War II, had already allowed assisted suicides. So they were quite liberal. Australia at that time did not, and there was, even in Australia, there was this big debate among should we, shouldn't we, but at a time when David wanted to do this, they didn't. And that's basically the story with him. He went off, whatever happened, I'm sure he did it. And that's case study number 1. And we have to decide how this plays into Judaism. Okay, that's number 1. Case study number 2 is on the other side of the spectrum. Okay, if you want to follow along on page 52, here's the case study B. Okay, an 11-year-old boy had been suffering for the past 2 years from a cancerous growth in his brain stem. Not a good thing. Okay. A significant accumulation of fluid was recently detected in his brain verticals, and a shunt was surgically inserted to drain the excess fluid. His physicians now seek to implant a different tube because the original tube had become blocked or infected. This procedure entails minimal risk, but it will prolong the boy's life and suffering. Is there an obligation to proceed with this surgery? The doctors don't give him much hope, of living.
Right.
He's suffering, so they want to put in this other tube. So the question is going to be, from Judaism, must he have this surgery? Do we have to force him to have this surgery? Okay, so these are the 2 case studies that we will be talking about this evening. Okay, so let's talk about first of all, we're going to leave the case study of B aside. The one with the boy and what we should do with him in interventions there. But let's talk about assisted suicide for a moment. Okay? There are basically 2 types of what we would call medical suicide. Number 1 is euthanasia, which means good death. I didn't know this, but thank God for JLI. Euthanasia is a Greek term for good death, because it's good for the person he wants to die, and then we're helping them along. So here, euthanasia is where the doctor administers the lethal medication to the patient. That's one. That's euthanasia. Right. Number 2 is what we call PAS, physician-assisted suicide, where the physician only prescribes the drugs, but you yourself, you do it. So euthanasia is where the doctor would flip the switch, whatever, whenever, are you ready? Are you sure you're ready? On the count of 3, and you hope that the patient doesn't go, no, and you flip the switch, and that's it. And the second one, PAS, which is physician-assisted suicide, is where the doctor prescribes the medication to you, and you administer it yourself. I'm sure it has to be done intravenously, whatever it is, and the nurse comes and does it for you, but you yourself are the one that makes the decision at the end of the day. Okay. So here in the United States, there are 11 states and territories that allow this. Okay, that allow a PAS, physician-assisted suicide. And California, where we live, are one of them. You can here legally have your, if you go through the process and, you go through the, whatever you have to go through, you can end your life. Basically, with the assistance, of a physician. So here we have two types of what we would call medical suicide. Both fall into the same category of what we would call these actively taking someone's life, because you're actually doing something to take someone's life, versus what we're going to talk a lot about, passively, just allowing someone to die. So you have active intervention, or you have passive non-intervention. And now we tonight are not going to make a difference between euthanasia and PAS. It doesn't matter whether the doctor helps you, whether the doctor prescribes it. Both fall into the same category in halacha. There's no difference. There's no difference in it. Okay, so we're not going to distinguish between the two. Okay, so again, there's one which is actively ending your life, and B, allowing a patient to die passively. Could we do that within Judaism?
What does that mean?
It means if the patient says, I don't want to take any medication. I'm not interested in taking anything. When the doctor said it's going to happen, goodbye. We're not going to do anything. That's it. Okay. Or not if the patient is not up. The family says we don't want anything to be done. Just let them know. Like with this boy, we would do is passively say, the family would say, thank you very much. We're not interested in the operation. We don't want him to suffer anymore. We'd like him to just go peacefully, and do that. Okay. So let's go to, if you don't mind, page in your books, page I think exercise figure 2.1, page 53 in the student's book. And I'm just going to read here the United States' position on this, because this went to the Supreme Court, of course, you can imagine. And this is from a court case called Cruzen versus Director, Missouri Department of Health. And this is what they came up with. This is the law of the land. Number one is, here in the United States, a patient has a constitutional right to refuse medical treatment. You can't force me to do anything. Even if they say to you, no, you're going to die, too bad. I don't care. I have a right to myself. Number two, artificial feeding, meaning, we want to put in a tube, is considered a medical treatment in this context, and the right to refuse treatment covers it as well. So if a patient comes into the hospital and the doctor says, we want to put a feeding tube in, he says, I'm not interested, then you can't force him to take a feeding tube. Okay. The right to refuse treatment applies to both withholding care as well as withdrawing it. Meaning if the patient says, I want this tube out of me, okay? You can put me on a ventilator, take me off the ventilator, take this tube out, yes. The doctor has to follow the patient's wishes, okay? As well as withholding care, meaning that the patient said, I don't want anything. So he could do it both actively and passively. So the patient is sitting in the hospital and he's there, and they put a tube in him, and then he wakes up and he says, well, what the heck is the tube doing in me? I want the tube out of me. You take the tube out. I mean, the patient has a right to do that. Now, where we have problems is when the patient is incapacitated, where they can't make any decisions. Remember the case where one family member says yes, another family says no. We'll get that a little bit later on. But if the patient himself is cognizant and knows what he's doing and says, I want out, the Supreme Court has clearly said the patient is the one that calls the shots. The right to refuse treatment pertains to all patients, even those who are not terminally ill. Meaning, if the doctor says, "Look, with some medicine, we can cure you, we can help you." Look about this guy David. I mean, if David walks into a hospital and something happens wrong, let's say, God forbid, such a patient has a heart attack. He's still in pretty good shape. A 90-year-old patient is in pretty good shape. And the 90-year-old patient says, "I don't want anything done to me. I don't want you to touch me. I don't want any CPR on me. I don't want anything." Even though the doctor says to him, "You're still in pretty good shape. You can still live." The Supreme Court has ruled, I'm the boss. You're not the boss of me. I'm the boss. And as long as I can make an informed decision, that's it. Finished. That's it. Then came along PAS. Then came along the question of physician-assisted suicide. Came before the Supreme Court. And the Supreme Court does what it sometimes does. It punted. Meaning that it said, this already we're not going to touch. Physician-assisted suicide. That you don't have a constitutional right to. But what we're going to do is, like we do in other cases, we punt it to the states. And that's why we have this situation that 11 states, including, you can imagine which ones. Now, the first state to allow marijuana, legalize marijuana was which state? Colorado. Colorado, because they're the mile high state. They're always high, so they were the first ones to legalize marijuana in America. They, of course, allowed this. California, you can imagine where else, District of Columbia, Hawaii, Washington, Montana, Maine, New Jersey. No, not New York. New Mexico, New Jersey, New Mexico, Oregon, Vermont, and Washington. So I guess the borders allow. So you have Maine and Vermont on that side, and Washington on this side, and New Jersey on that side. So you have, okay. Now, you would say, if I asked you, what do you think the percentage of Americans, we're doing a survey, what percentage of Americans are in favor of PAS, physician-assisted suicide? You would say how much?
40%.
40%? Anybody else want to give one of those?
Less.
55%? 75%. 75% of Americans are in favor of PAS. Yes. Do you know why? I'll tell you why. Not right now. We'll get to it. Why I think this number is very high. Okay? So what can you do? Withholding medication is a big thumbs up from the Supreme Court, right? Okay? Assisted suicide, no? Go to your states. Yeah, the states of Mississippi and Alabama, the ones, the more, those conservative states are going to not do it very quickly, but the ones here, left it up to the states. Europe, it's interesting because Europe is a mixed bag as well. Like, for example, in the United Kingdom, it's still illegal. But in the Netherlands and Belgium, in Canada, they allow suicide even for non-terminally ill people. Even non-terminally ill people they're allowed for, and etc. And then, of course, we talked about going to Switzerland. Interestingly, from the time that David Goodall went to Switzerland, Australia now allows it. Australia now allowed. So he could have stayed. He was very angry, by the way. I didn't mention that. He was very angry that he couldn't die in Australia. He was a proud Australian. Well, he just didn't live long enough. I guess 104 doesn't get you everything either. Again, you have to live to 140 to get everything you want. Go ahead, Sharon.
Oh, so some of those states, like countries like Canada,
Canada allows.
They also have a high percentage of refusing care for people who are older. For instance, where it's portioned out medical care,
Oh, you're talking about that? You're talking about socialized medicine. That's a good question. I don't know. I don't know that, but it would be interesting. I mean, you could tell the countries, the more liberal countries like European countries and Canada and these countries will allow it. Allow PAS. Why not? And again, we'll get to the principles in a moment or so. Okay. So here, this is all from the secular side of things. What does Judaism say about this? So Judaism is interesting. It's black and white. Okay, on this. This is not even a question, because we start off with the Torah, where the Torah says man was made in what? In the image and the likeness of God. Now, what does that even mean? I mean, if you look in the Torah and it says that Hashem says to whoever he says to, he says, let us make man in our likeness, in our image. You can imagine how many opinions that is, because God doesn't spell exactly out. But, according to commentators, which we're going to follow today, that the likeness, when Hashem says about our image, it's our intelligence. This is what Hashem said. What makes man different than all the other creatures that he created? intelligence, and the likeness, that's in our image. So our image, his image is intelligence. And number 2 is intelligent action, where we have free choice. We don't live only on instinct, but we have free choice of where to do. So clearly the Torah says, without a question of a doubt, that man was created in the image of God. Now you could see where this is going, of course. Now since that we are in the image of God, now who owns the image of God? Who owns what do you call when you do something? You have a product and you want no one else to make the same product. You put a patent, correct? So who owns the patent on human beings? God, since he made it, and the patent never expires, unlike other patents. So he's the one that owns humankind. So since we were created in his image and his likeness, therefore he still owns us. Therefore, we're going to extrapolate that who's the only one that could end this experiment or this experience? God. But not only are we going to say this because of the verses that God created us, but God clearly states that after the flood, Noah comes out. God had wiped out the human race except for 8 people, in the ark, and they come out, and God says, I'm going to bless you, that from you, the world is going to spread, and I'm going to put down a few little principles. One of the principles is that I don't want you to murder each other. Okay, the previous generation murdered each other. I don't want you to murder each other. Why? Because everyone is built in the image of God. So, murdering somebody would be like if, for example, if you had a king and you put up a poster of the king and defaced it. Can you imagine how shameful that would be to the king, how humiliating that would be to the king? We are God's image. So when you deface someone, when you hurt someone, when you murder somebody, it's an affront to God. So if you do that, I'm going to take it. Now, he writes, in the Torah, I will demand an accounting for your lifeblood from every creature and from the hand of each human and from the hand of each person for that of their brother. Now, that's a long way to say, so rabbis, of course, stopped and said, look, it seems to me a duplicate. I'm accounting for your lifeblood. I'm accounting from every creature, from every hand, and then from every hand of each person for that of their brother. So the Torah says, and then learns from this, as we're going to see later on in one of the readings, is that this is a prohibition against you taking your own life. That suicide is prohibited in Judaism. That you have no right, regardless. What about if a guy is terminal? No. What if a guy is suffering? No. What if he's terminal and suffering? No. What if he's terminal, suffering and incoherent? No. What if he's terminal, suffering, incoherent and there's a burden on his family financially? No. What if he's terminal, incoherent, and suffering and a burden on his family and they're emotionally distraught that he's living so long? No. What about all of these things and there's no quality of life? No. What if he's old? No. None. As far as I've seen, there's no exceptions to taking one's life. Either way, either through euthanasia where the doctor does it, or whether PSA where he gives you the So now why? I'm saying the verse says, I will demand an accounting from your lifeblood. So the Talmud clearly says, Rabbi Lezer reads this verse in an alternative form as stating, from your life I will demand accounting for your blood. For your blood, prohibiting suicide. So from Jewish viewpoint, life is precious. Life is absolutely precious. And therefore, only one that could take life is God. Even in the worst circumstances, no matter what the circumstances are, you have to do everything you can. Now, someone else takes your life, that's not your business. But if, as a matter for you saying to yourself that, I'm going to take my own life. Now, why? Why is there such a discrepancy between what Judaism says and what the American public feels and allows us to do? I'll tell you why. So here's what we get. The United States is built on 2 principles: autonomy and liberty. This is to them, to our country, which I love, by the way. I love this country. This is a great country. It has given us an opportunity to succeed like no other country in thousands of years. They've welcomed us in. They've given us opportunity. We've succeeded here, right? Totally. But the values of this country, which say liberty and what does he write in the Declaration of Independence? The pursuit of happiness and life. Because why? Because to them, I shouldn't say to them, because to society, the highest values are autonomy and liberty. Those two are inviolable. They're inviolable. You can't touch those things. You can't tell me what I need to do. Meaning, you can't say go to shul on Shabbos. You cannot force me. If I don't want to go to shul on Shabbos, there's no way you can send a policeman to my house to drag me to shul on Shabbos, except if you're the rabbi. Then they could compel you. But if you're just a regular congregant, there's nothing they can do about it, and they won't intervene. They won't intervene. I've tried a few times to get people to come, by coercing. No, sorry, that doesn't work. Why? Because who makes a decision about me in America?
You.
Me. That's it. That's it. End of discussion. You can invoke God, you can invoke church, you can invoke synagogue, you can invoke anything, values, principles, ethics, morals. It doesn't matter. Doesn't matter. The end of the day is when the line that's drawn in the sand is autonomy and liberty. That's it. So when it comes to autonomy and liberty, if a person says Dayenu, and I had enough, that's it. It's enough. Now, America, at least in the United States, for it to go PAS, for you to have a physician-assisted suicide, you have to be terminal. Means you have the doctor say there's no hope. Why are people so adamant that, at least here in America versus some other countries in Europe, that you have to be terminal? Because the people that are against physician-assisted suicide say, you know what this leads to? You know what autonomy leads to? Autonomy leads to, okay, why can't we do it today? Let's all do it now, today. And then the next step over is, we allow people to start taking other people's lives. What happens next? Someone that's incapacitated, and you say, my father definitely would have wanted this. There's no question he didn't want to live in this kind of state. He told us beforehand, so let's kill him. That's it. Now, and once you have the sliding pole, and you're going down the sliding pole, so that's why people are against it.
Called slippery slope.
The slippery slope. Now, once you open up this door, you can't shut this door again. So that's why people are against this. But as right now, for people that are terminally ill in America, as I mentioned before, 75% of the people say, if you're at this moment where the doctors say there's no hope, you can do that. Now, what does Judaism say to this? Well, Judaism says no. What autonomy? What kind of liberty? Yes, God gave us, as we mentioned 5 minutes ago, God gave us this wonderful, beautiful gift called free choice. It's an incredibly, it's an exciting way to live, where I know that I can make a difference. If everything is determined beforehand, I wake up in the morning and everything is set up for me day and night, boring. But if I know that I can make a difference, but I also know that I am not the ultimate sayer. I know that ultimately, when I wake up in the morning, it's only because Hashem returned the neshama to me. Hashem gave me back my neshama, so I'm able to get up in the morning and I'm able to do work. And I know that everything that I have comes from Hashem. Comes from Hashem. So my purpose in the world and my goal in life is to fulfill my destiny, which is, of course, to number one, take care of Hashem's world, and number two, to live the best possible life. And understanding that the ultimate sayer of life and death is God. Because why? Because we are created in the divine image. As you can read in text number 1 on page number 58, when Hashem says, I will demand an accounting for your lifeblood, from the hand of each human, from the hand of each person, for that of their brother, I will demand an accounting for a fellow human's life. Whoever sheds human's life shall have their blood shed by humans, for God made the human being in his image. So when it says your lifeblood, the rabbis interpreted those words to mean suicide. That you yourself cannot take your own life because you are not in charge himself. Now, so we have from the Torah, we have two different types of murder. Okay? We have murder, that's murder. Well, we all understand what murder is. And then we have what we call brotherly murder, friendly murder. Why wouldn't friendly murder be okay? Why shouldn't I? When I say friendly murder, I mean, when the patient is begging you and asking you to please, I'm asking you mercy. It's mercy. It's a mercy killing. I'm asking you, please. I'm begging you, do this for me. I'm asking you. And the person, on the other end of the conversation, thinks to himself, the man is suffering. The man is literally suffering terribly. Why wouldn't I want to do this? Why wouldn't I? Why shouldn't I do this? So if you please turn to text number 2, I'd just like to read this. This is from Rabbi Yaakov Meckelberg, who was an 18th century rabbi, a German rabbi. He puts it down succinctly. He says there are 2 forms of murder. One is murder intended to be detrimental to the victim. Right? You just take out the victim. Goodbye. As an act of revenge or in order to seize the victim's money or the like. A second form of murder is to the benefit of the other. It's the benefit of the victim. When someone is overwhelmed with tremendous pain and prefers death to life. So, okay, the Torah addresses both scenarios. Regarding murder with detrimental intent, the Torah warns from the hand of each human. I'm gonna get you, because if you dare go ahead and you murder somebody, I'm gonna get you. By contrast, the second form of murder, committed with the consent of the suffering individual and for their benefit, may even be perpetrated by a virtuous friend who may believe it's an act of a mitzvah. It's an act of a mitzvah. The Torah therefore warns from the hand of each person for that of their brother. So even if you think that you're doing a mitzvah, you're going ahead and you're saying to someone, please, I'm begging you, I'm asking you with this is my last wish, that do this. What's your answer?
No.
I can't do this. I can't do this. Right? So like the law says, if someone comes to you and says, please do me a favor, punch me as hard as you can. For whatever reason, punch me as hard as you can. What do? Don't punch them. Okay? Because later on you're going to say, and when a guy's going to sue you, you're going to say, but the guy asked me to do it. Well, really? You think a normal person's going to ask you to punch you in the face as hard as you can? Don't do that. Because it's not his body that he rules over it. So a person can't hurt themselves, can't lacerate themselves, the Torah has many, this, hurting themselves, whatever it is. So we have a question. In the Torah, there's a famous case like this. If you ever read the story of Saul, King Saul, at the end of his life, what happens? Him and Jonathan are fighting a war. They're losing the war. What does he do? He tells his today we call him his bodyguard, whatever it was, but it's his weapons carrier. Do me a favor, take the sword and kill me. What does he do? He does it. How? How could he have done it? So commentaries have always answered this question, because according to the way we're learning from Rabbi Mecklenburg, which of course everybody agrees to this, there's no controversy in this. Solomon was worried about many other things besides death. Death was the least of his worries. Saul. Saul was death was the least of his worries. He knew he was going to kill them, but the humiliation, what they're going to do to him, and all of that. That's why it gave them special dispensation, to be able to do this. But generally, can't. You can't do this. Only God Himself, God alone, is the one that arbitrates versus life and death. And that's the way it is. So even when it's a good death, even when we have euthanasia, and your heart is telling you, you know what, this is the right thing to do. That's why think about it. In the United States of America, this is what we say. This is what we say. Because why? What do we think with here in America? We think with our hearts. You see a person that's suffering, he's dying, he has no hope. So what's the purpose? What do you want me to spend? Should I waste another $1 million, $2 million in medical care, put myself in a nursing home? No one's going to come see me. So Americans, of course, are compassionate people. And the guy says, oy vey, look at me, I have no hope. And the doctors are giving me no hope. So society says, if that's the case, goodbye, have a good day. It's brotherly murder. It makes perfect sense in America because it's compassion. And we're compassionate people, right? We're compassionate people. And as long as that guy has a straight mind and he says that he's willing to do this and he wants to do this, in America, mavakasha, one less elderly person to worry about. If we can get more people to do this, matoivu manayim, we could save ourselves a bundle of money, because the business of America is business. At the end of the day, it's business. So we could save ourselves a bundle of money, a couple of $1 billion by getting rid of a few people. So who's gonna argue? This situation's not over here in America. We started now with PAS, and we're going to see how it progresses, because I don't give much hope that here's where it's going to stop. I could see this going one step or another step, another generation, further, because we respect life, to me, in America so little. We respect life so little here in America that, why not? If a person wants to kill themselves, go ahead. Here, take a gun, kill yourself. Who's gonna care? Anyways, but we're not worried about that. We're worried about, this is a class on Judaism, not in law. In legal law, and you go in front of the Supreme Court, you worry about that. But murder is wrong. Why is murder wrong? Because it's not nice to do to someone else. It's not nice because if you kill me, I'll kill you. No, why is murder wrong? Because a human being embodies the divine image. And no person has a right to undermine, encroach upon, and tamper with this sacred entity. And that's the bottom line that Judaism has when it comes to assisted suicide. Okay. So we answered question number 1. So if David, what was the guy's name? Goodall. If David Goodall, the 104-year-old scientist from Australia, walks into my office and says, Rabbi Perlmutter, I need your advice. What should I do? I'm down and out. I'm depressed. I mean, my family and this, I can't live anymore. I'm thinking of killing myself. Your answer is? No. Sorry. I'm doing it even though one time a rabbi was sitting in his office and knocked on the door, and a guy says, Rabbi, says, terrible, something terrible happened to me. My wife is trying to poison me. Really? Your wife is trying to poison you? Okay, you know what? Let me speak to her. Comes into the office. A few hours later, the rabbi calls up the husband. Take the poison. After speaking to the wife, he says, take the poison. Okay, I'm not saying in that circumstance could be extraordinary, because even though what we're reading about here, the rabbi should never allow the guy to take the poison, right? But in that circumstance, it's like King Saul. I mean, there's extraordinary circumstances. There's things worse than death, right? And that's living with her. Okay, but nonetheless, I mean, okay, but you shouldn't do that. You shouldn't take the poison. I'm just joking. I know. Okay, Rabbi, going to let the guy take the poison? No. I'm saying, you know what? I mean, I think this was even a statement by Winston Churchill. I think he had it out with somebody at a dinner party, and she says, you know what? If you were my husband, I would poison you. And his retort was, if I was your husband, I'd gladly take it. Okay? I mean, and that works perfectly with his character. But that's not for the class. No. That's just a joke. Okay, that's just a joke. I don't want you to take it seriously. So now, Mrs. Astor, but he had another line with her. So the other line with her was about. Okay, I'm not going to say it here. Next class. So save it. So here. That's this. Now here's the question that we go. Question number 2. The last few moments of life. How far do we go? Okay, to do this, because we just right now, if I asked you about what we should do to save a person's life, you would say what? How far should we go? Everything. We should do every intervention, right? If God is the only arbiter about life and death, and life is so precious. And you're not allowed to take your life no matter what the circumstances are, no matter what, how you're feeling or what you're feeling. Meaning, if you flip it on the other side, what do I do to preserve life? Everything. So even if you're in the worst case scenario, you're absolutely down and out, it doesn't matter. Judaism doesn't view that. Judaism only views life. So we do everything. Put you on a ventilator, put you on a breathing tube, give you a trach, a trach. You do everything possible to get that person to live. No matter, but you don't understand. I have 2 weeks to live. I'm riddled with. Doesn't matter, right? That would be the outcome of what we were talking about against suicide. So let's see. It's not so simple. The question at the end is not so simple. On one hand, we have. Please turn to text number 3 on page 60. Okay. And I will read the text. Don't worry, everybody out there in the Facebook world, I'll read the text for you. A person in the throes of death is regarded as a living person in every aspect. Okay? It doesn't matter. Someone may be the breathing. I mean, God forbid you should ever have to experience this, that you're in the hospital with someone that's dying and you can literally see the monitor. It's the heart rate is going down, the breathing is shallower and shallower, and eventually it goes. So even if it's way down, it's still, the person is alive. Though the patient is in terrible agony and they consider death preferable, we are nevertheless forbidden to anything to hasten their death. The universe and all therein belongs to God, and this is His will. So therefore, to number one, forget about it. There's no way you can do it. So now, here's where the problems start. Okay? The patient is on a ventilator. Okay?
Would you do that?
What do you do? What do you do? You come in and the doctor says, "Look, I'm really sorry." The patient's still alive. Okay? The patient's still alive.
By the machines.
By the machines, okay? Patient's still alive. So therefore you say, what do you do? You can't do anything. Once you put it onto the ventilator, you can't do anything. Now, I'm not so sure, because again, I'm not going to be the arbiter on this. If the patient is dead, the patient has died. Okay, the patient has died. Then you could. I mean, I would assume if the patient has died, how you describe death, when you describe the moment of death. But if the patient has died, then if there's no stems, the brain stem is over, then you rabbis would allow you to, you close. Yeah, eventually you're gonna have to close it down, right? You're gonna have to close down. But as long as the patient is alive, go ahead, Norma.
No, I'm just wondering if like what do they call it? The resuscitation. Okay, the person's gone. Just like
Person had a heart attack, and you want to know if you can do CPR on them
and bring them back.
Sure, it depends. So that's a good, very, very good question. That's an excellent question. So in Judaism, it would say, from what we're learning till now, absolutely, you have to do the CPR.
What if
because
they have a DNR?
that's going to be at the end of the class. We'll talk about a DNR. We'll get to the legal ramifications of this. But right now we haven't finished yet. We're still only halfway through the class. So right now we've only presented one side of it that says that, you know what, life at all ends, life at all costs, right? All costs. But that may not be the case in everything. Okay? Why do we do this? Why do we say this? That even a person that's incapacitated, that's suffering, that's this, why don't we have a little compassion and just say to ourselves, look, there's no hope for this person. I'm not talking about a person that can have some value, some quality of life, but absolute no quality of life. They're old, they're this. Why shouldn't we do this? Why? Right. Okay? So I'm going to give you 4 reasons why we shouldn't do this. Okay? The Torah tells you 4 reasons. Number 1 is the opportunity to do a mitzvah. The person still, even in the throes, could maybe say a Shema, could give something to charity, could do something, right? So even if they're down and out and something, there is still the possibility. And remember when we talked about principles, what is the underlying principle of a Jew? The underlying principle of Jew is, I am a walking image of the Almighty. And when does that stop? Never. Do I stop being in the image of the Almighty? Never. So, even if I'm down and out, even if there's no hope, there's still, I have a slight possibility of doing something good in the world. Something good in the world, right? Some other mitzvah.
But wouldn't that be compassion? To help, to just not do anything to try and save them?
That's different.
Well, one second, no, second. Yes. I'm saying why we're right now, why we would want to save them. Why would want to save them? There are going to be circumstances where you're going to say you don't have to, right? It's not going to be this is not going to be black and white. But the reason for saying why even a geisis, why is even a person that's dying still considered a living person? Yeah. They're in the throes of death. Because even in the throes of death, they may somehow, sometimes you just wake up for a moment or two or whatever, you become lucid before you pass away. So number 1 is you could still have this opportunity of doing and one mitzvah may save you from who knows what, in the world to come. Number 2 is repentance. The thing that we do there is what we call tshuva. So God forbid, when a person is in the throes of death, you come there and you say the vidi with him, the confessions with him, they would call this in America last rites. You do that. And a person does that and wants to do that. So even if when they're in the throes of death, they're still able to do that and have some regret on some of the things that they did. And number three is we are made up of two parts. Number one is the body. Number two is the soul. Okay? Now here's an interesting thing that Judaism talks about. The soul has a tremendous effect on the world because it is B'Tselem Elokim. The soul is an image of God. It radiates godliness. So the soul, just the soul itself, forget about the body, just the soul itself has a tremendous positive effect, on this world. Okay. But when does that happen? When does that happen? Not when you're born, right? Because when you're born, your only goodness is in a state of it hasn't yet been exercised in potential. Meaning, you know what? The baby comes out, and what do we wish the baby? It should live a life of Torah, it should live a life of Masim Tovim, of good deeds. The baby should grow up to be a wonderful person. But do we know? The baby could grow up to be the Rambam, and the baby could grow up to be a bum. Okay? We don't know. So when a kid is born, when the baby is born, then, we have tremendous hope and tremendous potential. But when do we actually see the extent of how the soul does have an impact on the world? At the end, because that's when the person has completely radiated the world more than anything else. That's why Solomon writes in Proverbs, the day of death is better than the day of birth. Why is the day of death better than the day of birth? Because in the day of birth, we don't know what's going to happen with this person. This person may turn out to be a bum, a murderer, a thief. Who knows what's going to happen to this person? So in the day of birth, when we're all standing and joking and happy, and when we're throwing a kiddush for him, we still in our hearts are only hoping that the blessing should take shape. Right. When a person is finally at the end of their life, and they've gone through life and the way it should be lived, then guess what happens? Then the soul radiates. Then the person's image himself radiates beauty into the world. And I've always said, when you live a tremendous life, one way, there's a very simple way to know if you lived a good life. If when you're born, you're crying and everybody around you is laughing. And when you're on your deathbed, you're laughing and everybody else around you is crying. Then you know that you lived a good life. But if the opposite is true, when you're born, you're laughing and everybody else is crying. And when you're dying, everyone else is laughing and, you're crying. Then it's not so good. All right? So the Rebbe writes that at the actual moment of birth, and you can please, if you would like to join me on text number 5 on page 62. At the actual moment of birth, the soul's light and revelation remain concealed within a corporal body. Its expression depends on the person actively sublimating their body through divine service. The more spiritual refinement a person introduces to their body, the brighter their soul shines forth and the more illuminates the world with godliness. But that's all true when they're alive. You see? What after their death? Of course, even more so. Think about it. The soul is released. No. Something happens to the soul that loses this shine. Okay? This insight explains the day of death is better than the day of birth. The spiritual powers we receive at birth exist only in a state of potential. When do they radiate in their greatest brightness? At the end of life. So at the end of life is when you fully see and appreciate what the person has been, what the person has done. Now, of course, the person has a tremendous effect, especially if you're a tzaddik after they pass away, what they can do to the world. Yes, but that's different. This radiance that we are so excited to experience only happens at the end of life. So here the person's at the end of life. That's why even as a geisis, even when someone's in the throes of death, we won't want to hurry them up because we're still radiating, we're still experiencing this intense shine from their soul. This is a little Kabbalistic thing. Someone asked a question, Dr. Weiner is asking a question on Facebook. How does Judaism define death? This is a very, very enormous question. This is not a simple question because there's many rabbis have weighed in on this. Death is, I don't know. There's a number.
Stop breathing.
You stop breathing. The heart stops. You put a feather. Your brain has no function, to it.
No. It's not brain death. That's
Not brain dead?
Not in Judaism, it's stop breathing.
You stop breathing. But how do you breathe?
But in California, no. When your brainstem
Right.
function, okay.
Right.
In California, that doesn't count. It has to be brain dead.
Right?
Well,
Means no activity in the brain.
Yeah, and that's by EEGs. You have to have 3 in a row.
Right.
Okay, but that's not
Not Judaism.
for this, no.
No. So Judaism is when you stop breathing, you're dead. That's it. You stop breathing. But what about you? Okay. But that we'll leave it at that. We'll leave it at that. When you stop breathing, you're dead. Okay. So I'll give you 3 reasons why even in the throes of death, we want to hold on as long as we possibly can. Number 4 is something so incredible. Learn meaning. Learn to mean something. Meaning, what do I mean by that? We have the ability to do something good for the person. Meaning that this teaches us how to care for someone, how to worry about someone, how to take gemilas chasadim, to do acts of kindness to someone. So while the person is still alive, we have the opportunity of doing that, making them more comfortable, talking to them, giving them, some kind of, not hope, but just talking to them and being there for them, love, care, and all of that stuff. So what it is, so he would say over here in text number 6, the reader may legitimately ask, what use is the life of a person who is comatose and incapable of cognitive brain functioning? Keep in mind, however, that Jew believes in a soul and the body is simply a receptacle for a person's true spiritual essence. Souls come to earth for many, many purposes, and we don't know why God sends it in. Sometimes it could be that the spiritual dead soul is to elicit certain responses on our part. The soul exists to teach us certain things about the meaning of life and love and how we relate to the dignity of a human being. And when we fail to respond with sensitivity and respect for the unconditional value of that person's life, we kill off a small part of ourselves. So that would mean that basically, it teaches us how to treat these kind of people. So that's a 4th reason why even in the throes of death, we still will continue to keep the person alive as much as possible. We can't hasten death. All of these things is interesting because what does not come into play here? Nothing. End of life doesn't matter. Quality of life, does it matter in our decision if a person should live or die? We're talking about a person is comatose, and we have to allow them to live. So quality of life doesn't come play. Does age play a part? No, it doesn't play a part. So we see here how Judaism looks very differently, at society in general, to tell you that here, when a person is dying, we have to just view them as if they're alive and walking down the street. That's it. You can't hasten it even for a second. You're a murderer if you hasten things. So we have here basically 3 ways of looking at the end of life: emotionally, intellectually, and what we would call in Judaism transcendently. And let's go through them. Because that's what we're going to be. Emotionally, that's where we have the United States of America, legalized PAS. The person is suffering, the person is hurting, the end of life. What do you say? Yes. Okay? So you think about it from an emotional standpoint. Yes. So we allow PAS to do it. Okay? And that would even be to the extent of we would make no restrictions. It would be like the most liberal country that would say that, if you decide to do it, go for it. No problem. Intellectually, we would say yes, but. Yes, but. The but meaning that we have to put restrictions on it, like here in the United States of America. You could do it, but the patient has to follow into this criteria. Number 1, they have to be terminal. Number 2, they have to be cognitive. Number 3, you have to play out these things. So that's an intellectual response. And we would look at it as a transcendence response. What's transcendence? Transcendence is when we get out of ourselves, right? Where God is transcendent. We know spiritually. How do we look at things spiritually? We looked at the body and the soul belong to God, that the soul has a tremendous impact on the world as long as they're alive. And all of these things leads us to say that as long as a person is alive, they're alive. And that's it. And nobody has a right to tamper with their mission and purpose for every last moment. And that's how we would basically look at it. Now, Okay, so that's all very nice and good. We know that you can't take someone else's life. What about treating? Now here we come to treatment. We still have the case of the little boy, right? Do we go through with the operation or don't go through with the operation? Okay, so here already we get into difficulty. Here we're going to get, it's not so black and white. Okay, and the first place that we're going to start is from a piece of the Talmud. We're going to study a piece of the Talmud that's in the tractate of Ketubot, which has to do with, with marriage, but this happens to be at the end of the tractate. Now you all know that one of the greatest people that lived in the history of Judaism was Rabbi Yehuda Hanassi. He was the author of the Mishnah. Yeah, it's hard to define this person because he was so brilliant and smart and productive in his life that he was definitely a first ballot Hall of Famer. I mean, if Maimonides says about him that he's somebody special, trust him. Trust him. Okay? He's dying. He's dying. Listen, everybody gets to this point, right? So let's pick up the story. Please turn to page 66, text number 7. This is an incredible piece of the Talmud. This is what occurred on the day that Rabbi Yehuda Hanassi died. Okay? The sages proclaimed a fast and they supplicated for divine mercy so that he would not depart from the world. Okay, so they were praying and davening. I mean, this is a special man. Please don't let him die. Kind of avoid this is going to be. Rabbi Yehuda's made one up to the attic and prayed. The angels on high asked for Rabbi Yehuda to ascend, and the people below asked for Rabbi Yehuda to remain. May it be at your will that those below prevail over those above. She was a good. Now this lady knew her stuff because throughout the Talmud she's mentioned a number of different times. If you grow up in the house of Rabbi Yehuda Hanassi and you overhear discussions, you yourself become a scholar. It's a funny thing it's interesting that what is the most important piece of furniture you have in your house? Think about it. What is the most important piece of furniture you have in your house?
The TV.
TV? And most people will say that. Your dining room table. Your dining room table. Why the dining room table? Because that's where everything is developed. So imagine if you happen to be just a woman that worked in the house of Rabbi Yehuda Hanassi and heard his discussions, his talk. If you sit around a table, you gossip all day. So what do you get at when your children become gossipers? But if you're living in the house of Rabbi Yehuda Hanassi, she herself became a scholar. So throughout the Talmud, she's met not many times, but a number of times as knowing what to answer. So she went up to the attic and she prayed for him to live. Later, however, when she saw that he was in great pain, she prayed, may it be your will that those above prevail over those below. She prayed that he passes away. Okay? The sages, however, would not cease praying, which prevented the heavens from gathering a soul. And she got nervous. So she grabbed a jug and threw it from the attic to the ground. Stunned by the noise, the sages stopped their prayers momentarily, and in the intervening moment, Rabbi Yehuda's soul departed. She was very smart, and she knew how to get it done. Okay, so here, what do we have here? Think about this for a second. She prayed, in the beginning, she prayed for his long life. Right. Every single second that he should go, he should go. When she saw he was suffering, what did she do? She switched. She switched teams, and she said, better for him to go. But what about praying for him to stay? Didn't we talk about for the past half an hour how important each moment was? And you could imagine Rabbi Yehuda Hanassi, how important it was. But she thought to herself, and since it's in the Talmud, rightfully so, that you know what? There's no mitzvah to prolong the suffering of this patient. There's no mitzvah to do it. That's it. It's just time to go. It's just time to go. Someone else will take over. And guess what? Kahava, he passed away. Someone took over. The other person, someone else took over. That's the way the nature of it. So from here we see that we've been talking that every single moment, but there are times under circumstances where the best thing to do is
let it go.
Nothing. Let it go. It's past the point of return. Let it go. And we're going to see now, the only thing that's left for us to do is to decide where exactly is that point. See, that's the key. That's the key. Because we made a general statement. There's times when we have to let go. But when? When? So thank God there are great rabbis that discuss this, and we'll offer 3 opinions of this. But before we offer the 3 opinions of the rabbis, we first have to set up the parameters. So on one hand, we're going to go for Maimonides, which we had last week as well. So we don't have to go through this, but I'll mention it just quickly. If God forbid a house collapses and there's someone that's underneath the collapsed house and we feel that there's still life there on Shabbos, even though that transgresses the holiday, the sanctity of Shabbos, you go there and you start taking away and digging and digging and digging until you find them. And even though that the chances of finding someone are slim, and even if you find someone, they're pretty bad shape, and even if you find someone that they're going to live, they're only going to live for a moment, and it could possibly be that they're suffering. So not only are you going to go and save them, they may be better off just don't let them go, because if you extract them from the rubble, they may live for a moment in tremendous agony and then die. So you may add to the agony of their death. But this is not a consideration. I'm sorry. All you got to do is don't think about that. You go in there and do whatever you can, even if it's to extend a life for a minute, 5, 10, whatever the circumstances are. If there's no hope, okay, there's no hope. But if there's still even a small chance of hope of saving someone, even for a little while, our job is to get in there. So now we have exactly the opposite. Because what would the Rambam say to the maid? When the maid says, "I want to pray that he dies," what would the Rambam say to her? Sorry, you can't, because here I just told everybody to go out there and to do this, etc., 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 and to save a life. So here's where the parameter. On one hand, we have the maid story, which says, "Sheval Tase, do nothing, let him go, let him be in peace, good." On the other hand, you have the Rambam that says, "No, even if you have a chance to, even a moment." Now, what would the Rambam say? Because again, in the Talmud, it tells us the story of the maid, but doesn't tell us who was right. Maybe the rabbis were right, but since most commentaries say, since this made it into the Talmud, means that she did the right thing. So we would agree with the maid. Okay? So on one hand, we have the Rambam who says, rage against the dying of the light. That means you have to go, no matter what, fight. Jewish law asserts that we violate the laws of Shabbos, even for the sake of one who's severely injured and can only live a little while longer, while we extricate this person who inevitably prolong their suffering. Nevertheless, we are obligated to make every effort to prolong their life. If this is on Shabbos, certainly in a weekday, we are obligated to make every effort to prolong life, even for a brief duration, and even if this entails additional suffering. So here we see again, we have two different opinions. One opinion would be Rambam's, at all costs save the life. The opinion of the Talmud, which would say there are certain times that you have to let him go. I think even the Rambam would also admit, at certain circumstances, that sometimes you have to let them go. Here, I think he pushes the envelope a little further, because what if you can save someone? What if you could actually save someone from the rubble? Then, of course, would there be any question that we would do everything we can to do that? Of course. So I think it's also psychologically. So if you think that, you know what, we're going to take away the rocks and the chances are, so he says, no. Do whatever you can, even if you could save it, because in a good circumstance, in a miracle, you could probably save a person's life in this. Okay. So now, what do we do? What do we do? So here we have, what I just quoted before about Jewish law asserts that we do everything. This is the opinion of Rabbi Eliezer Waldenberg. We had him last week, the Tzitz Eliezer, who, if you remember last week, said that you could only do a risky, an experimental thing if it was 50-50. He was the 50-50 guy. So he was the low man on the totem. He said if it's 50-50, then you could do it. So you had to have two criteria. Number one, it's not experimental, means it worked more than 50%, and it's not too risky that 50% of the patients survive this. So in this case here, he would be the most extreme. So the kid's family, the boy's family, comes now to Rabbi Waldenberg and say, what should we do? What does Rabbi Waldenberg say to them? Should we do this intervention with the child? Put in the new, is it stunt? Shunt. Should we put in the new shunt? What would Rabbi Waldenberg say based upon what I just read from his responses? Yes, absolutely. Because to him, there only is one criteria: living. Now, it can't be experimental and it can't be too risky. So obviously putting in the shunt is not experimental and it's not risky.
Right.
Okay? Those are the two criteria that he said. But if it's not experimental and it's not risky, it doesn't matter what the patient's status is. It doesn't matter if the patient is suffering. It doesn't matter if it's for 10 minutes. It doesn't matter if the patient is a kid. It doesn't matter if the patient, you have an obligation to do that.
Okay.
Ooh, that's strong. That's strong because to him, the one and only criteria is life. That's it. And he proves it from the Rambam. He says if the Rambam tells us that on Shabbos you have to violate Shabbos even if you get the person to live 5 more minutes in tremendous agony, right? What do? You stop? You have to do it. So he said, what's the question? If you extrapolate here into this case, this child could live another while, could be a year, could be a month, could be a week. That's not your business. Your business is only one. Answer this question. Is it experimental? No. We do it all the time. Is it risky? No. People get better from it. Do it. But when the child is suffering, the child is hurting, and what are we doing here, Rabbi? What are we doing? The child is not... That's not your business. That's not the question you should be asking. The question you should be asking is experimental risk. That's it. If the answer to both of these is no, doctor, intervene. Okay? So, in Judaism, you know what they say. If you're not happy with the answer of one rabbi, what do? You find another one. You want to have one of a consensus. One of a consensus of rabbis. Now, some people, I'm telling you, some parents would be very happy with this thing because they don't know what to do, and he's telling them clearly, do it, then they would do it. There's no question. Okay. Comes along Rabbi Moshe Feinstein, who I hope I don't have to give much introduction because he was the leading authority on halacha in the past generation. I mean, there was no one greater than him when it came to halacha. He was accepted by Hasidim and Misnagdim, modern Orthodox. Everybody accepted his ruling. He has maybe now a 15 or 20 volume series on Shalos Atrubis of Reb Moshe. Every kind of question came to him, and he was a brilliant man. I myself used him a few times, because by the time I was around as a rabbi, he was already an older man. I still remember him when I was a kid in Montreal. He came once to give a class. We were in like 3rd grade. He was our height, so it was perfect. He was a short little man. He came in. But later on, I had this difficult question with a Cohen and a convert and wanted to marry. And someone said, so listen, the only one that you can ask this question to is Reb Moshe. So what you have to do is you have to call his office. Sure. His grandson would answer the phone. You would relay the question. He would go to his grandfather, and then he would relay the answer to you. And he did it. He did it. I asked him the question. I was praying, hoping that this is the answer he would give, and that's what he did. He said, no, he's not a Cohen. Who says he's a Cohen? A guy comes into the door of a shul and says he's a Cohen. He's a Cohen? He doesn't know he's a Cohen, so why don't worry about it. He's not a Cohen. He made the Cohen no Cohen. But only Reb Moshe could do that. No rabbis wanted to take this upon themselves. So Reb Moshe was asked this question. He says like this. So this is what Reb Moshe says. Let's read it together in text 10a. 10a on page 71. If physicians can neither cure a patient nor ease their suffering, they should not administer treatment that only serve to prolong briefly the terminal patient's life in suffering. You don't have to. You don't have to.
Pretty clear.
No problem. Parents come to Reb Moshe. He says, is it going to help the kid? No. Finished. Have a good day. Don't do it. We infer this from the Talmud's description of Rabbi Yehuda's final illness. So he loves this maid, right? He loves it. The sages prayed and did not produce a cure for Rabbi Yehuda or lessen his agony, but only prolonged his ordeal for as long as they continued to pray. Rabbi Yehuda's maid, who was knowledgeable in the Torah, said maybe that those who prevail over, may your will be that those above prevail over those below. The angels prevail over the ones below. Upon seeing that her prayers could not be effective as long as sages continued their supplications, she took a jug, smashed it in order to silence them. At that moment, Rabbi Yehuda passed away. The incident is said in the Talmud to teach us that the maid acted correctly. Mm-hmm. We can derive from this that a physician should not administer a patient a treatment that will neither cure them nor alleviate their torment, but will serve only to prolong the life for a short duration in agony. Meaning that he puts a caveat here. Meaning The physician will only treat a patient not to cure them or to alleviate their torment, but will only serve to prolong their life for a short duration in agony, which is the case of the child, to put in the shunt. The physician should only administer such treatment if it will soothe the patient, meaning if the patient will be less painful. If it's not going to be less painful, and they admit it's not going to be good for the kid. So here, Ramesha is coming down, he's coming down the middle over here, sort of, or on the other side. He says, you don't have to do anything. If the patient is not going to get better, it's not going to soothe them, and it's only going to increase their agony for a short while, do nothing. But that's only for something that will not alleviate their torment, but will serve only to prolong their life. What about
in torment?
What about something, a breathing tube? No, I'm sorry, not a breathing tube.
No.
What about
Feeding tube?
a feeding tube? Feeding tube, Reb Moshe would say you have to, because first of all, that's not painful, and number two, he's in agony. I mean, you want to take away, except Reb Moshe said once that if there is sometimes circumstances where feeding a patient will make him sicker, and whatever the circumstances are, that the food going in there, whatever the liquid will make him sicker, then you don't have to. But if not, you have to feed him. The water the same way, and air the same way. You have to give them oxygen. I mean, if the patient can't breathe, you have to give them oxygen. So those things those things for sure, because his only saying that you don't have to is things that will only prolong their life for a short duration agony. So, CPR, for example, break the chest or whatever you can do. That is nothing. Intervention, amputate a leg, amputate something. No, absolutely nothing. But basic needs of water and food and air that you have to do.
And oxygen.
And oxygen. Okay? So he doesn't say life at all costs. Okay? Because he writes, in my response to the physicians, continue reading please, I wrote that one should administer oxygen to a terminally ill patient who has trouble breathing, even though no cure will result, because it eases the patient's suffering. For inability to breathe is tremendously painful. Accordingly, you asked regarding a terminal patient who's unable to eat normally, should we intravenously feed him and thus extend his life while prolonging his suffering, when it appears that he has no pain in abstaining from food, meaning he has no pain, as you know? My response, clearly we must feed the patient, provided that will not cause any harm, for food surely strengthens the patient somewhat, despite the possibility that neither the patient nor his attendants are aware of this effect. There is no need, however, to provide medicine with the assumption that it too will strengthen the patient, so that's besides the food, and the distinction is obvious. Eating is a natural need that is required to strengthen one's body and mind. So Rabbi Feinstein would say hydration, nutrition, and oxygen has to be given. That you can't withhold. It's not painful, and it helps. And even if you don't know that it helps, it helps. Go ahead.
What happens if the person refuses that treatment?
There's nothing you could do. We said it. Here in the United States of America, America will say to you, the patient has a right to do whatever.
Really?
Judaism says no, but in the United States of America, if a patient says, he tells the doctor clearly, I don't want any treatment, don't do anything to me, there's nothing. What are you going to do? What are you going to do? The same thing is true. God forbid, we're going to be dealing with in the fourth class, we're going to be dealing with death. We're going to talk about death and dying and cremation. We're going to see the same circumstances here. We're going to be the same circumstances. Anthony, go ahead. I'm sorry.
What about in Israel? What's the problem?
It's a good question.
It is.
It is a very good question in Israel, because first of all, Israel in general is a secular democratic country. Right? That's how it was established. Now, very different than here, because religion plays a huge, tremendous part. We have a rabbinate, we have a this and a that. It would, I would say, it would probably, I'm just assuming, it doesn't say, we haven't discussed this earlier, but I'm assuming that if you went to a secular hospital with secular doctors, there would be no difference than here. If you went to a religious hospital with religious physicians, they would follow the rules of the rabbis. That's the advantage of Israel. So if, let's say, for example, if you're a religious patient, you want to go to a place where they're going to care about halacha. If you're not, you could go to a hospital in Tel Aviv where they don't care. So it would probably break down that way. I'm assuming. If you had to do some research, I would say that Israel, because the secular are real secular, I'm not, this is not a condemnation on society in Israel, but they would no problem pass PAS. They would have no problem if someone was down and out in this dignity of a person's life, all of that stuff. Okay? Go ahead.
Just recently, when David's mother, 100 years old,
Yes.
she was in not assisted living, so there was no doctor who made decisions, but the people there made the decision. She started deteriorating, and they decided, she was laying down in bed, they decided to start feeding her. So the question is, and David, I think his neshama went, because he said, it's not right.
No.
But for over 5 days, she was lying there, breathing.
Nothing.
She just breathed.
Just breathe.
Breathing.
That's it. No food.
No food, no water.
But who made that decision?
The attendants.
The attendants there.
Who gives them the right to do that? What are
Well,
you talking
that's
about?
what it is. You're talking in Pennsylvania. I'm not talking in Israel, not the Rabbanim. Nobody was there to do it. And the only...
And David didn't know about this. The family
we
didn't
were
know.
there. No, we were there.
And you didn't ask to feed her?
David did.
And they said no?
They said, no, that's the end. That's how the body deteriorates and the body clears itself. And
Yeah, that's...
so
yeah,
it
well,
was not right.
no, it's not right. It's not right.
Where
It's not
was
right.
this?
This is in Pennsylvania. This is in Pennsylvania. There is one more opinion that I would like to presume, because we have here right now, we had Rabbi Waldenberg's that said, at all costs. Rabbi Feinstein said, not all, at no costs, you don't have to do this. There's a middle position. There's a middle. Of course, someone's going to squeeze himself in like... Now, we had him last week, Rabbi Auerbach. We spoke about him. He said like this. This is what his thing, and if you want to follow along, page 76. There is a difference between treatments that satisfy the natural needs of a patient, or those considered ordinary treatments, and those are considered extraordinary treatments. So he breaks it down into ordinary treatments, extraordinary treatments. Rabbi Feinstein does not. Rabbi Feinstein said, if it doesn't help you long term, he doesn't care what it is. It could be an aspirin you don't have to take. Okay, if it's not going to help you. He doesn't make any kind of distinctions. Rabbi Auerbach now is going to make a distinction between ordinary treatments and extraordinary. Let's see. For example, if a patient suffers from metastasized cancer and is about to die, although they are in pain, we may not withhold the required oxygen, nutrition, and hydration. Okay, that they agreed. If they suffer from diabetes, we may not withhold insulin with the intention that they die sooner. Okay, insulin is easy to administer. Blood transfusion and any other medication that the patient requires, such as antibiotics, should not be withheld. And that's where Rabbi Feinstein may have an issue with him, saying, well, not he doesn't want, you don't have to give the antibiotics. Okay, he says it should. And on the other hand, there's no obligation to initiate an extraordinary medical procedure. That is, procedure that would itself cause much pain in addition to the pain that this patient already experiences. If this treatment has no chance of curing the underlying disease, but only of extending life for a short duration. So there he would agree with Rabbi Feinstein that extraordinary things you don't need to do. CPR, amputation, things that would be painful and all this. So he tries to take both sides. He tries to play both sides. On one side, he says, I agree with the Rambam that you have to do everything you can to prolong life if it's what we call ordinary treatments. Medication, antibiotics, whatever it is, if it doesn't go. On the other hand, he agrees with the maid that if extraordinary circumstances to go out of normal, that you don't have to do. So he kind of plays both sides. Rabbi Feinstein is the most liberal, where he would say you don't have to don't do anything. Hydration, yes. The three, when we talk about hydration, nutrition and oxygen, those three you have to give, but everything else, what's the use? You're going to force the patient to take antibiotics? No, you don't have to. He says yes, because it's no big deal. So, if you don't mind, this is because we talked about three opinions. There's going to be a chart here, so let's go over the chart. Because then it clearly spells out what, who, what, when, and where. This is figure 2.2, and I'll make it easy for those in the Facebook world. We have like this. Question number 1, physician-assisted suicide. we started. The answer is all three. Rabbi Feinstein, Rabbi Auerbach, Rabbi Waldenberg, all this say no. Finished. Removing a respirator or anything else keeping the patient alive. Rabbi Einstein, Rabbi Auerbach, Rabbi Waldenberg all say clearly no. You can't do anything that's going to hasten the patient's death. Okay? Declining hydration, nutrition, and oxygen. All three unanimously no. And here's where they break down. Declining non-painful life-extended treatments. Okay? Declining non-painful life-extended treatments. Rabbi Auerbach and Rabbi Waldenberg say no. You cannot deny that. You have to do that. Rabbi Feinstein? No. He allows it. You could decline it. There he said the patient, if you don't want to, you don't have to. Declining painful medical treatment? Okay? Rabbi Feinstein and Rabbi Auerbach would say you could. Rabbi Waldenberg says you can't. So Rabbi Waldenberg is pretty consistent, and he would say under no circumstances can a patient decline medical treatment. Rabbi Auerbach would say yes, a patient may, only under the circumstances where it's painful, and it's not going to do anything, so then you could. And Rabbi Feinstein says even if it's not painful and it's not life, then it's not life extending. Even if it's life extending, but it's nothing, you can. So here you have three various opinions. All three of these people have now students that follow their opinions. So if you find someone, because all three of them are gone, none of them are alive to ask these questions anymore. So now if you're in Israel, for example, where I think Rabbi Wallenberg and Rabbi Auerbach lived, if you end up with one of their rabbis, and you're going to get those opinions. So you have to find out who's the closest to Rabbi Feinstein. if you don't want to. If you want to, then you go there. If you don't want to. Okay. So that ends up that. We have one last thing that we need to discuss, and that's what you were talking about, a DNR. Right. So now they tell you here in America, Helen brought up a good question. Her mother-in-law was over there. They didn't feed her. The family wanted. They said they're not going to feed her. So now what do we do here in this case? So,
but in addition, just a little bit, they gave her this. How do you call this medication? For painkiller.
They gave her narcotics. Yeah. For her, this is called palliative care. So palliative care means they're just going to make you comfortable. Yes. They're not going to do anything to make you comfortable. Okay. So here in America, we have what we call advanced medical directives. Okay, advanced medical directives. You can have a living will, which most halachic experts say is no good. Don't write a living will when it comes to health. Why? It's too ambiguous. That you are never going to be able to put down under all circumstances what you want. Because at the end, you may want to say, you know what, God forbid if I get into an accident, I don't want them to do anything extraordinary. But that word extraordinary is already ambiguous. What do you mean extraordinary? I mean, if you have a broken leg, you don't want them to set the broken leg. You'd rather get gangrene and then in the hospital and die over there because of this. What about you're having a heart attack in the hospital? You want them to. So most rabbis, halachic experts, will say a living will is not enough because there's just too many areas that are going to come into play that the family's not going to know what do we do now. Dad, no, he didn't want that. Yes, he did want that. No. So stay away from a living will. A DNR is again problematic in halacha because a DNR again tells you do not resuscitate. Now, what does that even mean? Do not resuscitate means you're going to come into the hospital, they're going to fold their arms like this. Again, it's too ambiguous. What you want is, in the best case scenario in halacha, is what they call a healthcare proxy. You want someone, you designate someone in your family that you say, when it comes to issues of health, they make the decisions. Whether it's a child, they suggest you do it with a child and a rabbi. So the child should always go to a rabbi because every situation is different. Every situation is unique. Every situation, if you came to Rabbi Feinstein, he was not going to answer, I heard this case last week. No. Every case is unique. Every case is different. Every case needs a special attention. And that's why the best thing to do is to provide a healthcare proxy. You appoint someone and you say, you, my friend, whoever that's going to be, you're going to make the decisions at the time of need, and you're going to consult with a competent Orthodox rabbi, not someone that just got a smicha, on a bus. He was driving from Tel Aviv to Yerushalayim.
He wouldn't want to do it.
Who's that?
The rabbi on the bus.
No, I'm hoping. I'm hoping he wouldn't want to do it. But some guys are arrogant, thinking they're rabbis. But you want a competent Orthodox rabbi to be there with you, and together you and the rabbi, you will decide at that particular moment what should happen, how it should happen, and when it should happen. That's the key. That's what most authorities would tell you to do. Get yourself a healthcare proxy. How you do this is you could go. The RCA of America has, if you go to them and you can look on page 84, it has a halachic healthcare proxy. It goes on for page after page after page. You can read it through at home. You don't need to do it right now. It's called the halachic healthcare proxy. If anybody in the Facebook world, I say again, this is from the RCA, Rabbinical Council of America. It's called halachic healthcare proxy. Okay, HHCP, halachic healthcare proxy. You could read it through, you sign it, you get it notarized, whatever the circumstances are. Okay?
We do?
Because he says over here, this was one. I'm just going to read this quickly. The effects of do not resuscitate, that's what you brought up. Okay, DNR orders on physicians' decisions to provide life prolonging treatments other than cardiopulmonary resuscitation for patients near the end of life was explored. The presence of a DNR order may affect physicians' willingness to order a variety of treatments not related to CPR. If there's a DNR, the doctor may say, well, I'm not going to order it. Patients with DNR orders may choose to forego other life-prolonging treatments, but physicians should elicit additional information about patients' treatment goals to inform these decisions. So again, that's the problem with the DNR. It may be too non-specific. So the doctor may say to himself, I'm not so sure what the patient would want. Does he want me to do? Does he want me to do? So therefore, a proxy takes away all of these clouds. It takes away that someone who's there, someone that the patient trusted, knows that they're going to follow according to what they wanted to do, and that would be the best suggestion if one wanted to do that. Okay. I just want to finish off, because we only have a few minutes, that in every class of JLI, there's a bechein. There's a point where, why? What's the purpose of doing this? The purpose was not to depress anybody here. We all know that end of life is coming, end of life. The point being is that here one should always think about, like when we talked about the difference between American society and the way Judaism looks at the person. What is my purpose here? What is my purpose here in life? Why am I here? We should always be asking ourselves that question, because at the end of the day, when we're, God forbid, at this stage, at the end of life stage, we don't want to have regrets and say to ourselves, you know what, it's just, if only. Like we mentioned many times, nobody on their deathbed ever said, I wish I spent more time in my office. No one ever said that. What they say is, chaval that I didn't spend more time with my family. I didn't spend more time in things that were valuable, studying Torah, doing better deeds, helping someone else, caring for someone else. One last deal, one last dollar, it's nothing. So the whole class is to focus ourselves. Yes, we talked about some halachic situations. We talked about end-of-life care, what you could do, what you can't do. But the key, of course, is when we walk out the door, we should be thinking about ourselves. What do we still have to do in the years that we have left? Whether it's 5 years, 10 years, 20 years, 100 years, who knows? You never know. Like in famous Pirkei Avos says, one of the rabbis says, you should do tshuva the day before you should always do tshuva the day before you die. Really? Good advice.
Every day.
Every day. So every day one should always be thinking about what ayeka. Remember, there's a famous story, where God, after Adam and Eve, sinned in the garden, God came looking for them, right? And he said to Adam, Ayeka, where are you? All the commentators say, why does God have to say Ayeka if he knows everything? Why does he have to say, where are you? So the simple answer is going to be because he wanted to engage him in small talk first. They want to freak him out. Like, I'm really angry right now, and so he says, Ayeka, sort of to calm Adam down. But there's a story of the Alter Rebbe. The first Chabad Rebbe was in prison, and this question was asked about to him, and this discussion came about. And he asked the Russian guy, whoever was the interrogator, Ayeka. He asked the Alter Rebbe, why did God have to say Ayeka? So the Alter Rebbe, instead of giving him the pat answer, said, I'll tell you why. When someone is 52, which was his age, he knew the age of the prosecutor. When someone at the age of 52 walks around life, every day God comes to him and says, Ayeka, where are you? What have you done with your life? That already, the Alter Rebbe turned the tables on him, because they thought they're going to be smarter than the Alter Rebbe, didn't realize who they're dealing with. He turned the tables. He says, every day God asks you, Ayeka, where are you? Meaning, what have you done? I've given you all of these opportunities. I've given you everything that you need to succeed. What have you done with with all of this? Like we talked about with the baby, with all of the potential, where are you going? And that's really the purpose of the class. Next week, what we're going to do is we're going to flip the script. What we're going to do is we're going to go back to the beginning. Okay? We've done tremendous advances, on keeping people older. We've also done tremendous advances in pregnancies, and in childbirth. So God willing, we will stop for a while on dying and go back to living next week and allowing people to live. But in the meantime, like we said before, let's keep living. And the definition of living is not breathing. Like Rabbi Feinstein would say, there's basics, right? Hydration, food, and oxygen, right? That's the basic. But that's how we're talking about living. I mean, living is every day to produce something special, to be something special, to do something special. And that's what this is all about. Create. To live. So let's say l'chaim and keep going. Thank you. Let me just say goodbye to the people down in Facebook. Let me